Are you a go-getter in your profession and at home? Taking care of everyone but forgetting to prioritize yourself? Welcome to the Healthier Go-Getter, the show that brings together health professionals and wellness experts to bring the inside knowledge to empower you to take charge of your health and elevate your wellness game. Let's become go-getters for your health so that you can bring more joy to your life and your loved ones.
Hi everyone, my name is Margarita with MAM Massage and Spa. Today our guest is Dr. Adam Turbeville with Young Chiropractic. He was born and raised in the Copperas Cove, Texas, into a military family with both of his parents serving as surgeons in United States Army. He received a Bachelor of Science degree in cell and molecular biology from Texas Tech University, then attending the Parker College of Chiropractic in Dallas, Texas. Now his mission is to serve his community in the healing art of chiropractic at the highest level in the effort to make the world a better place, one spine at a time. Before our show started, I'd like to thank our sponsor, Elysian Wellness Aesthetics. It's a locally owned clinic specialized in regenerative and rejuvenative medicine. They are your one-stop shop to look and feel better. They offer medical weight loss, hormone balancing, Botox injections, laser service, skincare, and many more. Check out their website at www.elysianwellnessokc.com for more details about their service. They will love to see you over there. Dr. Adam, our audience, all of us, we are go-getters, right? I'm seeing that you've been making such great journey on your pursue your chiropractic career. So who inspired you to become a go-getter? Who inspired you to become a chiropractor?
Who inspired me to be a go-getter would be my dad. He was in the military and he was always up early. He always went to work. He never missed a day of work ever. And was really committed to the job. So he inspires me to want to do my job at the highest level. How I got inspired to be, there's no one particular person that inspired me to be a chiropractor. It was just when I had to go to a chiropractor, I just felt so much better when I went, and it looked like a really fun job. And the chiropractor seemed like he was having a good time. And then that's what interested me in it. And then I looked further into it and I wanted to do that.
So you mean when you go to the chiropractor is because of you have a car accident or anything?
Yeah. That's exactly why I did it. A lot of people don't know you can just go for wellness. You can just go to feel better and to feel optimized. But I went because when I was about 17, 18, I got in a car accident, and it was pretty significant. It was like a T-bone car accident. So it was head-on collision. And I went and I didn't feel it didn't have anything terrible with me. I didn't have like a miracle story or anything like that, but I just felt better. I felt all around better. Everything about how I felt was just head and shoulders above what I was doing. And it seemed like a really nice environment to be in. And the chiropractor was loving his job. I loved to go there. And then I started looking into it, and I was like, wow, this actually makes a lot of sense. You don't need drugs or surgery to heal the body for particular things. So that's what I wanted to do.
Nice. Yeah. So I had the same experience when I get into massage therapist because I was in pain, and I get the help from the massage therapist, which really inspired me. Right. So for me personally, when I heard the story, why people get into the profession is definitely resonate how the results they want to give to their patients, right, or clients. So now I want to ask you, I want to dive a little bit deeper on the car accident that you had when you were 17. So do you have like whiplash or have anything Yes. What was the
Yeah,
symptom?
absolutely. When I got in that car accident, I definitely got whiplash, and I remember at the time it didn't feel terrible. Like I didn't feel that bad. I think I was sore. I was definitely shooken up. It was pretty traumatic, but I didn't feel bad. I mean, I was 17, athlete, so the symptoms, and you're a guy, so you don't complain. So the symptoms weren't really that extreme. But if you look at my X-rays now, I have a pretty significant curve in my upper back and a little bit of loss of neck curve as well. So it's really easy for me to start to feel bad if I don't get to my adjustments and get taken care of. Uh, this whiplash scenarios, they don't feel like they're a big deal, but they definitely affect the shape of your spine and the functionality of your spine. And then if you don't get it corrected, a couple of decades later, then the symptoms start to show up and it starts to be harder and harder to correct. So we see a lot of people in our office, late 30s, 40s, 50s, they got in a car accident in their teens and 20s. Now they're starting to experience some of the degeneration of the spine and some of the symptoms that come from that.
That's very interesting. Yeah, I definitely believe that even though during the massage muscle injuries, right, it's going to be really easy for them to getting hurt again, or like scar tissues will be easy to build up and then they're very easy to getting hurt. So I have a question for you is like, what make you special than any other chiropractors?
Oh man, results, results,
Result.
results, results. Yeah, absolutely. We definitely don't mess around. When you come in here, it's my responsibility to take care of you and tell you the truth and tell you what you need, and do what is necessary to get you well. When you come in, the first thing we do a consultation, and it's at no charge, and we do detailed history, and history, 82% of it, it'll tell you exactly what's going on the majority of the time. So I think 82% of the diagnosis comes from history. And then so we get that detailed history. If I need diagnostic imaging, I have an X-ray unit. So we'll do X-rays on the specific area or the whole spine or whatever is needed. Maybe we need to refer out for MRI or something else, but we definitely get some imaging. Then from what I'm seeing on the X-ray, from what you're telling me, then we'll do a detailed exam. Those exams, it could be, orthopedic tests if necessary, or just palpation. We find we get whatever I see on the X-rays. I would definitely want to put hands on and touch and see what's going on. How well does that joint move? How well it moves tells me how healthy it is and what we're getting into and kind of the depth and breadth of it. Then I put it all together. So what I see, from what I'm feeling, from what you're telling me, I come up with a plan to get you fixed, and not just a Band-Aid fix. I really want to make sure that this is corrected and you're going to be better in 5 years, 10 years down the line. That's what I'm thinking about.
Yes, you're right. So in terms of when you see your patients, right, what are the most challenge have you ever faced too?
It's really a challenge if they're inconsistent with their care. I have full confidence in chiropractic as long as they get the amount of treatments that they need. It's real tough whenever you have somebody that's really injured, but their schedule, they can't get up here. I have a new patient last week, younger guy, I think he's in his 20s. He is very acute, a lot going on his X-rays, but he lives in Norman. For you guys that don't live in Oklahoma or in this area, that's about 45 minutes away. And he's younger. It's tougher for him to get up here. So it's gonna be harder for him to heal fastest with the best quality if his schedule doesn't allow him to get up here as much as he can. So, or as much as is required from me to get him well. That's what's tough, is when you see that they're hurting, but yet they can't do what's in their best interest to get here. That's a tough case.
So let's break it up a little bit. So now, can you share a fun fact about yourself?
Fun fact. Okay. This is gonna. So I'm a nerd. I like to read a lot of books. I'm always reading. But a fun fact would be, me and my wife have been we've been playing Dungeons and Dragons for the past 7 years. And so
Wow.
it's just a nerdy tabletop game, but we like it.
Yeah, I heard.
It keeps your friends close and your family close, and you can kind of touch base with them each week. So it's fun.
Yeah, I can see that. My boyfriend's friends, they like to play that too. Big
Oh,
big
really?
fan. Yes,
Okay, I thought I was
yes,
the only one.
yes, yes. So the fun fact right here is kind of my advertisement, right? Since I am here trying to keep everybody's be motivated and then be entertained. So the fun fact is going to be my advertisement for the show, part of the show. So now let's get back to our formal kind of conversation, right? So what types of patients or symptoms do you mostly commonly treat?
Um, it varies so much because what we do is allow the body to heal itself. So it could be anything from, like, we'll just talk about what we saw this week. So I have a new patient. Well, he's got a reactivation, but he has a shoulder pain. He's a golfer. Shoulder pain and wrist pain. That's his complaints. So we take care of that. I had another guy had a tubing accident. He has rib problems. And then we have another patient. She's in her late 30s. She had a slip and a fall. She was taking care of her grandma on hospice. So there's a lot of emotional stress too, but she slipped and fell. Everything hurts. She has constant headaches that turn into migraines a couple times a week, but from when she wakes up, she has a headache to when she goes to bed. And she has back pain, low back pain, mid back pain, just pretty much everything. So it really varies on the person. And what I really do is I don't really treat their symptoms. I just make sure their spine and their joints are being restored and maintained. And that, when we do that, symptoms go away. It's the irritation of joints when they don't move. They kind of irritate the nerve roots at that area, and they can cause symptoms and pain and things of that nature.
So, like for our listeners, right? So when people they are having a pain, they might have a lot of pain that they don't know how to describe. So I think I asked you before when we will have like one-to-one together, right? So trying to know a little bit more our practice. But so like in terms of like when people do feeling the pain, how would you describe that pain that when they need to go to see you?
Great question. There's pretty much two types. You have kind of your chronic long-term pain that kind of feels like a dull achiness, and it could be anywhere. It can be in the neck, back, shoulder, just kind of that dull chronic achiness. And that's usually you get those day to day, or it's sharp shooting. That's kind of your acute. That's kind of like you just had trauma to wherever out in your body, and it's sharp shooting. It hurts when you do certain movements, and maybe it'll shoot down a leg, down an arm. Any one of those you can go see a chiropractor for. Your chronic, your dull achy would be great for massage therapists, because that's a chronic issue, and that maybe you can get work done and some resolution of that pain with them. Sharp shooting, you can definitely go see a massage therapist for that, but it's more of it can be more of a serious nature, and so that they may have to refer to a different person. So I always like the idea of trying your less invasive, your simple stuff first, and then kind of go up from there. If you already have a relationship with your massage therapist, go to them, see if they can't help you. And then if it's one of those things where they can't, usually they have a person they can refer to, like a chiropractor they can refer to, and do that. But if you have a relationship with your chiropractor, do that as well. Go to both and see what the problem is and get it corrected.
Yeah, 100% agree with you. Even though I am doing like a muscle related chronic pain, whenever things happening, if I feel like the clients didn't get the best results on the massage session, I always then, hey, when you have like a very sharp pain, but very kind of happening very in a shorter period of time, like so then I will refer, hey, you try to massage, if you feel like don't feel any good within like 2 to 3 days, I think you should go to see a chiropractor so they can make an adjustment. And then the other thing I will refer to physical therapists too. So I feel like all of us working together can make a better results for the clients when they are in pain, right? So that was really good. Yes. So actually, I have a question. One of the question is for my clients yesterday, and he had a car accident before when he was younger, and so I believe the conversation is he hasn't really go to doctor or anything like that. He adjusted, but he didn't go regularly. And so now is like whenever he had a car accident and then make him like, if he sit too long, then he will have like a pain. But he was driving a lot recently. And so when he came, so he have very pain on his hips and the lower back area. And so I was trying to working around. The main thing is like his problem was at sacrum, the S1, and then L5. So that was the problem.
Classic.
Another area, yes. So and then he felt like shooting pain down his glute area. I did try to working very depth. And then he feel like relieved, but I said, if you don't feel like it's not enough, and then I feel like you should go to a chiropractor, ask the adjustment. So within that, I wonder, the reason I bring this up is like when people have those kind of symptoms, what would you suggest them to do?
Well, it depends. If they want to, I don't know how long it's been going on, but if they want to get it fixed, then we have to restore the joint. So the L5S1 aren't moving appropriately, and maybe it's his lack of motion if he's sitting down there too long, or maybe it's a trauma from the car accident, or it's more likely the combination of both of them. He has trauma from the car accident, that joint's not moving appropriately. Now he sits all day, and it's just every time he moves, that joint's not moving the way it should, so it's irritating and it's pinching that nerve, and that's why it's shooting down a little bit towards his glute. If he wants it fixed, he's got to restore and maintain that joint. He should definitely come into a chiropractor. It doesn't have to be me, anybody around him, to get eyes on that, to see how bad that joint is. So definitely I recommend an x-ray for him, see what condition that joint's in, and then develop a treatment plan that's appropriate for it. I mean, if that joint looks great on x-ray, then maybe it's going to be a little bit less time to get it fixed. If it looks like, stage 3 degeneration and we get some bone spurs there, really reduce disc space, and maybe it's going to take a little bit longer. So I see that all the time. That's one of the most common complaints is low back complaints in L5S1 with a history of trauma. A lot of guys who used to play football, that's going to do it. Just the motion of tackling and running into people is going to do that. What he can do at home is move. So if he doesn't want to do a chiropractor, then just getting motion in that joint by him walking, exercising, dieting if he's overweight would definitely take stress off that joint as well. And you can do the combination of all of it. Go see your massage therapist, go see your chiropractor. I like, or your physical therapist. I like what you brought up earlier about those, us three, is they don't involve drugs or surgery, and definitely do those options first before, try to do it the natural way before we have to do an intervention with drugs or surgery. Pharmaceuticals are powerful. There's always a side effect to them. They don't really fix anything. They don't treat that cause, which is L5S1 not moving appropriately. They just turn off the symptom. You have pain, we'll get rid of the pain, but you're still going downhill. That joint is still not moving appropriately. You just don't feel it. So and then when that doesn't work, then they want surgery to permanently make it not move. That's what I would recommend. All the above.
Yes. Yes, you're right. I 100% agree with that. So and the other things that I want to ask is like since a lot of people who are as a go-getters, right, especially our audience, everybody trying to working so hard, taking care of everything, but forget prioritize themselves, right? So do you have any like suggestions, like any like healthcare tips that can share with our listeners so they can be able to practice at home?
Yes, it all starts with diet and exercise. You can't, you guys are go-getters. You can't get what you want with doing what you want. You kind of have to go out of your comfort zone. You kind of have to try new things. You have to do things that are hard, that are difficult. Diet's hard. it's not fun, but you can't eat what you want and then kind of have the body that you want. So it starts with diet and exercise. If everybody dieted and exercised, we wouldn't have there wouldn't be a lot of medical doctors out there. There wouldn't be a lot of physical therapists, chiropractors, massagers. We just wouldn't have as much to do. I mean, people get injured, car accidents, stuff like that, but we wouldn't have large patient bases because diet and exercise will knock a lot of your chronic issues out. We'll get acute stuff, but your chronic stuff would be kind of lessened by your adaptability and your resiliency from diet and exercise. That's what I would recommend. And if you don't know how to diet or exercise, pay somebody, pay a personal trainer, pay a dietitian, pay somebody. And sometimes that, as a go-getter, you have to pay attention. Sometimes you just got to pay people.
I 100% agree with that. Yes, you're 100% right. So, what make this podcast different is our guest will trade for a massage here at the MAM Massage and Spa. So we haven't did that yet for you, but I know that you came here before. That was a long time ago. So how do you feel about that massage session?
Oh, I remember it. You have a great way of being gentle and then being hard when you need to. So I appreciated that. I mean, you were mostly nice to me, but then sometimes you'd have to get after me. So I like that. You did great. Okay, and I can't wait for the couples massage. I'm gonna get my wife in.
Before we're ending up this conversation, I want to ask you how our audience can be able to connect with you.
Facebook, Young Chiropractic. You can go to our website. You can call, Google, anything like that. If you're interested in getting results with whatever health concern you have, like I said earlier, consultation is free. We can figure kind of out what direction we need to take it, and I'm looking to get a fix. I really want to treat the cause, not just the effect of what you're dealing with.
Nice. What I will do is I will drop down your contact information or your website on our show notes so people can be able to reach out to you if they want to. So, and then the last thing is you are going to speaking at our chronic pain events, right? So, what are you going to talking about at that event?
I really want you guys to know what chiropractic is, what it isn't, and what to expect when you go to a chiropractor. And they'll even talk about how to choose a chiropractor. The choice is me, of course, if you're in Oklahoma City. But if you're not, then I'll explain that too. Like, what are you looking for? What kind of signs when you go into an office? What do you want to hear from your chiropractor to know that they know what they're doing? I think that'll be a nice value, as well as just understanding what we do.
Yes. And then were you gonna have slides showing how's the bone section, how that functionality works, everything?
Oh yeah, I'll do a brief overview of like how the nervous system works and what we do with that.
Yeah, with the bone together, right?
Oh, for sure, because what we really do is we affect the nervous system by restoring and maintaining the joints. Every joint has a blood supply and a nerve supply. And if these joints don't move, they start to irritate that nerve supply. Well, the nerve supply goes to organs, they go to tissue, and they can cause disease and disease pathology. So definitely, I'll get into all the nerdy stuff, the good stuff.
Nice. That would be so awesome. Okay, so Dr. Adam, I really appreciate your time, and then I will see you at the chronic pain event, maybe even sooner. And for the couple massage, right? Yes.
Of course. Looking forward to that. Well, thanks for having me. I appreciate you.
Yes. Thank you. Bye-bye.
Bye.
Remember, being proactive about your health is the first step towards a brighter, healthier future. So until next time, keep that go-getter spirit alive, stay proactive, and never stop pursuing your wellness dreams. Connect with us on Instagram at Healthier Go-Getter. Check out more great interviews at mammassageandspa.com or follow us on Spotify, Apple Podcast, or any other podcast platform. This show is for educational purposes only. Contact your doctor or physician for any health concerns.